Hello, everybody. So, unfortunately, my laptop is having some issues and isn't recording audio. So, I'm going to do this on my phone, and I wanted to apologize in advance for how shaky it might get. All right, thanks. I have a question for you all. Would you mix lighter fuel, tar, and some pesticides and then drink them all at once? Your answer is probably going to be no. One, because you know that they're harmful, and two, you know that they would result in immediate death. What most people don't know is that all of these substances are contained in a cigarette. Smoking cigarettes not only affects you, but it also affects the people around you. Contrary to what most people believe, smoking cigarettes does not only harm the lungs of the smoker, it also causes other harmful effects on the smoker's health. As many smokers know the dangers of smoking, they never try to stop. Today, I will be telling you about all of the harmful effects of smoking a cigarette. Nicotine is put in tobacco products to make people more addicted to smoking. Nicotine is a drug that travels through the bloodstream, soaking into your internal organs, causing a stimulation. Every time the nicotine enters the human body, the stimulation occurs. It sends a signal to the brain, which causes the smoker to feel good, or even in rare cases, excited, making them want to smoke more. Have you ever asked yourself what is actually in a cigarette? Every tobacco manufacturer has a different list of ingredients and makes their tobacco in different ways from other distributors. According to Philip Morris, there are 245 active ingredients in one single cigarette. The tobacco itself only has 109 ingredients added to it. And the first ingredient is called acetic acid, in which they add 0.0% to enhance their flavor. And if you do not know what acetic acid is, it's a colorless liquid organic compound that is considered a weak acid, but can be corrosive on the skin of a human body. The World Health Organization provides guidance on health throughout the world. The organization points out that not only is the tobacco harmful to humans, but also to the environment we live in. Smoking drastically affects the lungs. According to research, about 85% of cases of chronic obstructive disease, COPD, and lung cancer are a result of smoking. Cancer cases that are caused by smoking include cancer of the mouth, cancer of the uterus, bladder cancer, pancreatic cancer, and esophagus cancer. Using tobacco also causes heart disease. According to the World Health Organization, smoking causes a high risk of getting a heart attack and a stroke. Smoking can also cause infertility among women. During pregnancy, smoking can adversely cause severe damage to the fetus development. In most cases, during birth, the infants are born with respiratory issues and underweight. Premature birth has also been on the rise due to smoking. Smoking is associated with the following fertility problems. Problems with the fallopian tubes, including blockages, preventing egg and sperm from meeting, and an increased risk of ectopic pregnancy. Cervical changes, specifically an increased risk of developing cervical cancer. Damage to the eggs as they develop in the ovaries, increased risk of miscarriage, possibly due to damaged eggs, damage to the developing fetus, or unfavorable changes in the uterine lining, which may make healthy implantation of an embryo less likely. It should be noted that not all of these issues are directly caused by smoking. They may be associated with each other. For example, smoking probably doesn't directly cause blocked fallopian tubes. Women who smoke are more likely to engage in other unhealthy practices, including unsafe sex. Risky sexual behavior can increase the risk of pelvic infection and blocked fallopian tubes. Notably, more smoking leads to longer time to conception. Research has also found that the more cigarettes a woman smokes a day, the longer she will take to get pregnant. According to one study, which looked at just over 4,000 women, after 3.5 months of trying to get pregnant, almost 60% of non-smokers had achieved pregnancy. For women who smoked 1 to 10 cigarettes a day, around 50% have achieved pregnancy. And lastly, for women who smoked over 10 cigarettes per day, only 45% had achieved pregnancy after 3.5 months. If quitting completely does not seem to be in the cards for you, cutting back is still worth trying for. Smoking during pregnancy is associated with miscarriage, low birth weight, and premature birth. Another important reason to quit smoking before you conceive is to reduce your risk of birth defects. Because many birth defects occur very early in the pregnancy, sometimes before a woman even realizes she has conceived. Waiting until you get pregnant is not enough to reduce the risk of harm to your unborn child. A large systematic review on smoking and birth defects, which include 11.7 million controls and just over 170,000 children with congenital defects, found that smoking during pregnancy increased the risk of heart and cardiovascular defects, limb defects, where an arm or a leg fails to grow fully or is completely missing or extra fingers or toes, clubfoot, cleft lip or palate. Moving away from the effects as mentioned earlier, smoking can also affect your well-being. For example, it changes your sense of smell and taste, affects your ability to do physical exercise, causes a change of color in teeth, and also places you in a higher risk of being affected by anxiety and depression. Since it is a very addictive substance, the user will have to incur the cost every single time to buy cigarettes. Those who have cancer from smoking will also bear a more significant cost for treatment. I would like to end by saying, on the off chance that you are a slave to cigarettes, it would be ideal if you realized that it is never past the point where it is possible to quit. With the help and conventional activity design, everybody can stop smoking for good. On the off chance that you accomplish this target, you will see its advantages in an initial couple of days. After some time, your hazard as an ex-smoker for creating tobacco-related sickness tumbles to the level related to lifetime non-smokers. Settle on the correct decision for your well-being and quit smoking. Thank you.